Hi everyone, today, I will introduce Osstem's OneGuide, a digital guided surgery system that enables precise and predictable implant placement according to the treatment plan. Let's look at the general benefits of digital guided surgery. The first benefit is achieving precise implant placement even in multiple or edentulous cases. Because the digital planning process is performed with the final prosthesis in mind, the optimal implant position, angulation, and depth can be determined so that the implant is placed at the exact center of the prosthesis. This allows implant placement exactly as planned in the prosthetic center, enabling highly aesthetic restorations with excellent long-term stability. As shown in the image, even in cases with 3 or more implants or in fully edentulous situations, implant surgery can be performed confidently and accurately. The second benefit is easier flapless surgery. By using a surgical guide and a tissue punch, the gingiva can be precisely removed at the exact implant placement site, ensuring accurate access compared to conventional surgery. With the flapless approach, the procedure becomes simpler and more convenient than an incision-based method, reducing the time required for incision and suturing. In addition, patients experience minimal pain since there is no incision, resulting in a more comfortable treatment. Faster gingival healing also improves overall patient satisfaction. The third benefit is convenient immediate loading. When ordering OneGuide, if you also request a temporary crown and abutment, they can be fabricated simultaneously and delivered together with the guide. In edentulous or anterior cases, when good bone quality allows for sufficient primary stability, immediate loading can be performed after implant placement, significantly improving patient satisfaction. In addition, both stock abutments and custom abutments can be selected, allowing flexible treatment options tailored to each clinical case. The fourth benefit is faster preparation for implant surgery. By requesting fabrication through the OneGuide Center, the time required for treatment planning can be significantly reduced, improving overall clinical efficiency. Predetermined implant specifications and the corresponding healing abutments can also be reviewed and ordered in advance, enabling faster and more convenient surgical preparation. In addition, the surgical report helps identify anatomical risk factors such as surrounding bone conditions in advance, providing valuable clinical insight. It can also be used as a patient consultation tool, helping to increase patient trust and treatment acceptance rates. The following section introduces the specific benefits of Osstem OneGuide. The fifth benefit is more convenient guided surgery when using OneGuide. OneGuide adopts the Osstem 122 taper kit protocol, enabling a simplified drilling sequence that reduces overall drilling time. Excluding the initial drill, implant placement can be completed with just one drilling step in soft bone, or 2 steps in normal and hard bone, making the procedure highly efficient. In soft bone, drilling is performed one size smaller, in normal bone, at the nominal diameter, and in hard bone, one size larger. This simplified protocol becomes even more advantageous in larger or multiple cases, where clinicians can experience significantly greater efficiency and convenience. In addition, OneGuide features a side open function in the surgical guide, allowing procedures even in posterior regions with limited interarch space. When designed in an open type, it enables an additional 3 to 8 mm of working space. Furthermore, with the newly improved angled type side opening, more precise drilling can be achieved. As shown in the image, the angled design allows the drill to enter at a slight inclination, providing greater vertical space. In addition, the angled structure increases the contact area between the guide and the drill, improving stability and reducing vibration during drilling, which enables highly precise drilling. In addition, OneGuide offers a range of dedicated kits for different clinical cases, expanding its treatment versatility. The standard OneGuide kit can be used from single cases to fully edentulous cases. For sinus-related procedures, the OneCAS kit allows safe and convenient sinus surgery without the risk of membrane perforation. The ONE485 kit is designed for placing short implants ranging from 4 to 8.5 mm, as indicated by its name. It is particularly useful in posterior mandible cases where vertical bone height is insufficient due to bone resorption, or where the inferior alveolar nerve is in close proximity. Similar to the CAS kit, it features a rounded drill tip that helps prevent nerve damage. Finally, the OneMS kit is designed for narrow ridge cases in the anterior mandible. It allows placement of mini implants ranging from 0.2 to 3.0 mm. Because the anterior mandible often has limited bone width and a pronounced ridge, making drilling path control difficult, this kit enables precise and stable implant placement without slippage, even in narrow bone conditions. The sixth benefit is more precise and safer implant surgery with OneGuide. The OneGuide drill features a tapered, multi-step design as shown. During initial drilling, the guide and drill are firmly stabilized, allowing controlled and stable drilling. After the initial osteotomy, the bone is shaped into a stepped configuration, so when the second drill is inserted, it achieves a double contact stability, supported both by the guide and the previously prepared bone path. This minimizes vibration and enables highly precise drilling. The drill design within the guide system further enhances surgical accuracy. Next, a cooling path has been applied to prevent bone overheating during drilling. Clinicians who do not use guided systems often worry about insufficient irrigation and potential bone heating, but OneGuide addresses this concern. Previously, as shown on the left image, the internal structure of the guide hole was partially closed, which limited irrigation flow. However, irrigation is still effective when using an up and down pumping motion during drilling, and the system maintains a safe temperature of approximately 36 degrees Celsius. Currently, as shown in the right image, a cooling path has been applied inside the guide hole to improve irrigation flow. This has increased irrigation volume by more than 2 times compared to the previous design, and the drilling temperature has been reduced by approximately 4 degrees Celsius. As a result, implant surgery can be performed precisely as planned using digital guided surgery, and with OneGuide, procedures become faster and more convenient. This concludes the introduction to OneGuide. Thank you.